Hi everyone, my name is Amy Yan. I am Astanza's Client Marketing Manager. I want to thank you all for joining us today on this webinar, Aesthetic Treatments in a Time of COVID-19. As you all know, many states and local governments have enforced some form of shelter-in-place mandate to stop the spread of the coronavirus. Unfortunately, that means that for many non-essential businesses, including medical spas, laser clinics, and other aesthetic practices, that you've had to temporarily close your doors. Even if that's not the case in your state, you've probably seen a lull or delay in treatments and patients coming in because they're choosing to stay home for their safety, but this is just momentarily and temporary, right? But during this time, with that being said, we've received many questions from our own clients and other aesthetic practitioners about different treatments that are being impacted due to coronavirus, right? Namely laser tattoo removal and laser hair removal. So as a practitioner, you might be wondering, upon reopening, how do I make sure that I resume treatment safely and effectively, right? Are there any protocols that I need to be changing? And on top of that, what do I tell concerned patients who are worried that this lapse in treatment is going to affect their results? To help answer these questions, I am joined by Justin Arnosky. He is Astanza's VP of Clinical Education. Before we get into the webinar, Justin, do you mind sharing us a little bit about yourself and your background with the aesthetics industry?
Yeah, absolutely. Hi, Amy. Hello, everyone. I'm glad to be on the webinar, help answer some of these FAQs as we try to resume some normalcy, hopefully at the beginning of the summer. So for those of you who have not spoken with directly, my name is Justin Arnosky, and I'm the Vice President of Clinical Education at Astanza Laser, as well as the Director of New Look Laser College. I've been with Astanza for almost 7 years now, and I've been teaching practitioners across the country and internationally about laser tattoo removal, laser hair removal, pigmented vascular lesion treatments, as well as skin resurfacing. Any device that Astanza Laser carries, I have some experience in treating and training folks on how to properly treat. I come from an engineering background, primarily biomedical engineering, and I've been servicing lasers all across the country internationally, as I mentioned, and trying to teach practitioners how to do the best possible treatments we can. So I'm happy to answer some of these questions around laser treatments, given this unforeseen and unusual layoff that we're all experiencing.
Yeah, thanks so much for that introduction, Justin. Yeah, basically reiterating, Justin is really an expert in anything regarding clinical treatments. So we're super happy to have him on this call. All right, let's dive right in. Before we get into the clinical recommendations, can you give us a quick overview of hair growth cycles and the physiology of laser hair removal?
Yeah, absolutely. So hair growth occurs in cycles, and each cycle has 3 very distinct phases: telogen, anagen, and catagen. Telogen is the phase involved for shedding fully grown hair. Anagen is the actively growing phase of the hair, and catagen is the resting phase, where it becomes detached from the papilla and the blood flow, and essentially what allows that hair to grow in the first place. Laser hair removal is working by targeting the hair shafts in the anagen phase. That's going to be able to allow the laser energy to be distributed into that follicle, into the papilla, in order to disrupt that growth process, hopefully to the point where that follicle will be damaged enough to either grow hair more thinly, less densely, or perhaps not at all. Because this growth is occurring in cycles, however, only a percentage of the hair is being treated at any one time. That's why we need multiple sessions in order for a laser hair removal to be, that permanent hair removal or permanent hair reduction that we so much desire.
Right, yeah, thanks for that recap. I know most of our laser hair removal practitioners already know that, but we just wanted to remind you about that, and if your patients are watching this, to give them a recap of how the hair growth cycle works. Yeah, so moving on, something that many laser hair removal practitioners are really curious about are clinical recommendations right now, especially for laser hair removal. Can you share your recommendations for how to treat patients after this long waiting period? Are there any protocol changes that practitioners should be aware of?
Yeah, I would say that there are a few accommodations that we need to be considering when we start trying to resume laser hair removal treatment in particular. So in our present situation, we're going to be seeing treatments return with a little bit more hair growth than they would have if they had to stay on a regularly scheduled return to treatment. And it's going to be determined by that. By the number of factors that go into how much hair is growing in the first place. So we're talking about location of the hair, genetics, etc. Some patients may require an additional treatment or two to play catch up, but that's not going to be the case for everybody. Many patients are going to see a fantastic reduction throughout the process. So if you're 4 or 5 sessions in, your hair is most likely going to be thinner, more sparsely populated across your skin than it would be if you're in the first session or two. So that's certainly something to take into consideration. If a patient has exceptionally dense hair and is early on in the treatment, those are the folks who might need an additional treatment. And again, that's not going to be everybody. In terms of how you should be adapting your protocols, you should really be thinking about treating the hair you see. So what that means is that regardless of the number of sessions that they have had or how they presented in their very first treatment, use your best judgment as a clinician to assess the coarseness and the density of that hair and adapt your protocol to this new baseline. So it's going to be really difficult for you to just say like, okay, they're on treatment number 4. This is going to be, a step backwards. Like that's not really how this works. Always use your best clinical judgment, just like you were assessing somebody in the first place, before you decide on how much energy you're going to be using. One other really big consideration to be taking is their tanning level and current sun exposure. When this all hit, we're talking about February, March is when we started seeing some of the things being shut down and postponed and canceled. So you're going to be looking further down the line, May, June, potentially, until you're able to treat some of these patients, depending on where you're located. And so there's been a lot of UV exposure. We're getting from spring into early summer. So there's going to be a lot of people who are going to be coming through a lot more tan. And I don't know about everybody else, but my yard looks fantastic. I've had a lot more time to just go outside and spend a little bit of time mowing the lawn and getting everything ready for summer. So that's not going to be unique to me. I'm positive you're going to have a lot of people who are coming in because they've been stir crazy. They're trying to do a little bit more work outside. And so they're going to come back with the darker skin tone. So take that into consideration. That might mean that you have to reduce your energy settings. So if you were at 16 joules, you're down to 14 joules. Consider about a 1 to 2 joule drop in that energy setting. And that might get you a little bit closer to what you're looking for. If you're in the professional mode with the re-smooth, if you're in an advanced, later on in those treatments, potentially think about reducing that, reducing your pulse format. So go from a single pulse with a very high energy into a double pulse to spread that energy out a little bit more to not cause quite as much damage to the skin. You'll also need to really re-emphasize the importance of avoiding UV exposure. Again, depending on when somebody started their treatment protocols, they may have started in October or November, and this will be their first summer as they're going through laser hair removal. So it's really important that they understand that UV exposure is not a good mix. Laser treatments thrive when you have a lot of pigmentation differences, when you have a lot of contrasting pigments. Darker hair follicles with a very light skin tone is going to give you the best, fastest, most effective laser hair removal results. So remember, that's going to give you the best results if they're able to avoid that UV exposure.
Right, yeah, I can attest to that. I've been spending a lot more time on my balcony, so thank you for sharing that information. I know that practitioners need to hear that. Now, what about patients? A lot of hair removal providers and laser hair removal clients that we've had, they've been sharing how, there are concerns among their patients about this lapse in treatment that they're experiencing. What can you tell practitioners to share with their clients about the expectations that they can have for their results during this lull?
Yeah. So, you'll have a lot of patients who come through the door and they just, you say antigen, telogen, catagen, and they just whoosh. It's not going to really make a whole lot of sense. So it's best to try to figure out a way to portray this information in a way that's going to really sink in, to let them know that you're going to be treating them safely, effectively, and that just because they've missed a round of treatments is not going to necessarily indicate that they have to spend more time getting these treatments. So again, we're looking at hair that's going to be in the actively growing anagen phase. It's that growth phase. Once treated, we've either damaged or destroyed that follicle, so it's not really going to be able to produce that hair. And that's not going to change. We've done the damage to that follicle, so it will not regrow, or it regrows with a thinner hair, potentially less dense hair in the given area that you're treating. The reason we see more hair is that we've effectively missed a few growth cycles. And again, that the number of those growth cycles and the amount of regrowth that's occurred is going to depend on that location and genetics and those kinds of patient factors. In all likelihood, the hair density will be less than it was before, but depending on which number treatment we're on, the reduction may be imperceptible. 1 to 2 sessions, you're still going to have a lot of new growth, while 5 sessions in, it's going to be pretty significantly reduced, and you might need to be changing those pulse formats a little bit more to be more aggressive. We will continue to treat and remove the actively growing hair. We're going to resume regular treatment. So we're not going to try to accelerate to try to play catch up or anything like that. Their new course of action is not going to be the same 2 to 3 months, 4 months, however long it's been since their last treatment. We're going to try to get them back on our recommended clinical treatments depending on those factors.
Right. All right, great. Well, I think that answers everything for laser hair removal. Another procedure that we've been receiving questions about is laser tattoo removal. Let's go through the step-by-step like we just did. Can you remind everyone of the physiology of tattoo removal and how it works?
Yeah, so remember our elevator pitch. And when I'm doing trainings, if I haven't trained you specifically, it's very possible that one of the other engineers from Astanza said the same exact thing. We're looking for an elevator pitch. We're trying to explain laser tattoo removal in a way that's going to make sense and it is going to be able to be portrayed very quickly. So we're breaking down the ink in a smaller bite-sized pieces so our immune system is able to remove the ink in a faster, more efficient way. The body recognizes ink as foreign matter, and so we're actively working to remove it. Remember that a laser tattoo removal treatment only takes maybe 15 to 20 minutes in the actual clinic, and then it's 6, 8, 10, 12, in this case, maybe 16 weeks between each of those treatments. So it's going to be really, really dependent on how long between each of those sessions. That's how much work is going to be done by the body to remove that tattoo ink.
All right. With all that being said, what are your clinical recommendations for laser tattoo removal?
So the big takeaway is that if you haven't been using your laser in the past couple months and you find that you have to use a little bit more energy than you'd expect in order to get the response you're looking for, remember we're talking about snap, swelling, and snow. Those are your 3 S's of laser tattoo removal. You may need to jump up by a jewel or 2. Having a greater jump than usual is not an indication that your laser is not functioning properly, okay? If your system is regularly cleaned, if you've had preventative maintenance and you really haven't been using it, and the laser's been safely locked away while you've been required to be shut down as a non-essential business, as a non-essential procedure, and your laser's not throwing any errors, it is functioning normally. So don't be alarmed if you have to jump 2 joules, 2.5, 3 joules, particularly if you haven't treated somebody in 4 or 5 months. That's not necessarily an indication that your laser's malfunctioning. You may be right at that threshold where your last treatment you saw some nice white frosting and they come back in 4 months later and you don't see that laser snow anymore. That is totally normal, okay? You're still going to look for that nice loud snap as well as a pretty significant swelling, and that might be an indication that you have a good reaction. Also, if you're used to using a 5mm tip and you treat somebody at 3.5 joules and their next treatment, you increase the energy up to the 4 and you don't get a response and you have to go all the way up to the 3 and use 6 joules or so, that is also going to be something you may potentially see. It just really depends on how hard that body's been working on removing that ink. So if they're a super fit individual, somebody who, is very active, they have a really healthy immune system, those are good indications that their body's going to clear out the ink very quickly. The one wrinkle to this, if you're using the described patch, you can continue to increase your energies as you go through those 2nd, 3rd, potentially even the 4th pass. Increase those energies until you see some of that ink ejection. Once you get that ejection, that should be your limit. So you can continue to increase your energy through the described patch. It's not necessarily going to be any kind of over-treatment with that particular patch. That's the benefit of using that technology. It allows you to have more aggressive settings and sessions without some of those same kind of risks that we would potentially see with traditional pass.
Right. I'm glad you mentioned the described PFD patch because I know a lot of our clients use it. Can you actually really quickly tell people who aren't using it what the described PFD patch is and how it works?
Yeah, the PFD patch is a perfluorodecolon liquid in combination with a silicone gel patch. What you're able to do is to treat an area that's about the size, 3x3, 4x4, about the size of your palm, and you can do multiple passes over top of that treatment area. It allows for multiple passes in order to remove the ink a little bit accelerated timeline. You're still going to put the same amount of time between each of those PFD patch treatments, but the way your actual clinical treatment will go is you take the liquid that's distributed in the little patch, in the little pouch, dip it into the perfluorodecolon liquid, apply it on top of the tattoo, treat through the silicone gel patch. You're able to have a little bit more aggressive settings, pull the patch back, reapply more PFD liquid, and then treat again through that silicone gel patch. If you do have more questions about that, please feel free to reach out to me and I can walk you through it, and we can send you some samples of those PFD patches so you can see if it's going to be a good addition to your practice. We love people who start using that patch. It's a really great way to help accelerate and offer something a little different for a lot of your patients.
Yeah, it could be a great tool to implement once you're able to reopen your doors. And like Justin said, we have a lot of great information on the PFD patch on our website as well. So definitely visit our site for more information. Alrighty, so lastly, I want to ask what you can tell laser tattoo removal practitioners, what to share with their patients, right? And patients who are concerned about their results and their lapse in treatment right now.
Yeah, and I totally get this, especially when you're talking about name tattoos. People are going to be super motivated to get that tattoo removed, right? We're getting into wedding season. People are on a time crunch. They need to get rid of a certain kind of tattoo because they either want their parents to see it, it's their ex's name, whatever the reason may be. There's going to be a lot of motivation to try to remove these tattoos as quickly as possible. And so they may be super concerned that they've missed a treatment or two in the downtime that we've had to deal with. So your patient may ask you, how can we speed this up? How can we get back into resuming the treatment? And really, it's not going to make much difference if you try to accelerate the time between each of these treatments. The PFD patch can be a good option in order to try to catch up on some of that, but trying to reduce the time between each treatment is not going to really help that much. We're still looking to have a 6, 8, or 10-week spacing of those actual return for treatments, depending on the wavelength, skin type, location, side effects that they've been experiencing, those kinds of things. Those are going to be the same variables that we've typically had. And remember, this is going to be largely an immune system driven procedure. So we're looking at having some of the removal being done outside the clinic. And that means that the body has still continued to work through this, even through quarantine, even through shelter in place. That body still knows that the ink is foreign matter and is going to continue to remove it. So the body has still been working. We're still going through the removal process, but this lapse is not going to be a justification to try to accelerate the timeline to put it between 3 or 4 weeks. It's just not going to make a lot of sense for most patients. In addition to that, just like with laser hair removal, you really got to emphasize the importance of UV exposure. Again, we're getting into the summer months. It's going to be a little bit more difficult for people to keep those areas covered, particularly on very exposed areas, wrist, finger tattoos, those kinds of things. It's going to be really difficult to try to avoid some of the hyperpigmentation that can occur with UV exposure. So really reemphasize the importance of wearing sunscreen and reapplying and keeping it covered when absolutely possible. So really just reapply that sunscreen and everything will be just fine.
Great. Well, we've reached the end of this webinar. I want to thank everyone for watching, and thank you, Justin, for joining and answering all these questions. If we didn't answer your question or you want a more elaborate answer, an in-depth answer from Justin, you can email him at jarnosky@AstanzaLaser.com or info@newlooklasercollege.com. Alrighty, guys, we hope everyone's staying safe. Thanks for joining us.
Thanks, y'all.